broadcast. So let's get to the governor. He's leading our state's response to COVID-19, Governor Doug Ducey, joining us live this morning. And Governor, I'm going to start this interview the way I've started our other ones, and that is thanking you and your team for all the long hours to help manage this crisis. And thank you for taking a few minutes to talk with us this morning.
Thanks for having me on, Troy. I appreciate it.
Okay, so I watched your briefing yesterday, and let's start with some of the facts that you and Dr. Kara Christ brought up. And if I get anything wrong, please point that out. But they seem pretty encouraging. So recent models were showing that we should be in the beginning of our peak of COVID cases. But our hospitals are in good shape, you said yesterday, or Dr. Christ said. Only 10% of people being admitted are COVID cases. 50% about of our ICU beds are open. 75% of our ventilators are available. So this is not over. We all know that. But are we past where we should fear becoming a hotspot like a New Orleans or a Detroit or a much lesser New York?
I think what I would say is so far so good in Arizona. I want to thank Arizonans for their responsible behavior. We had the stay-at-home directive. People have been doing that. They've been staying home, they've been staying healthy, and they've been staying connected. And the objective was to slow this virus from spreading. And effectively, we've been able to do that in Arizona. If we have a hot spot, it's been up on Navajo Nation. We've been able to surge medical supplies and personnel and a field hospital there with our National Guard. But for the rest of the state, we've avoided that type of situation. We want to continue to avoid it. The president and federal guidance goes through April 30th. It coincides with the state's guidance. So this is something that we are literally watching hour to hour and day to day. But where we are right now is a positive position, and we want to be prepared for whatever can happen. The modeling has pushed the peak out, so we'll be able to see it if it indeed does come. We have some confidence that we can do even better if people continue the responsible behavior that they've demonstrated so far.
And the positive thing, too, I think, Governor, is that we're able to start talking about, while I know you are not want to put a date on this, we talked about April 30th, but we can start talking about what opening up will look like. When I very first met you, and this was years ago, it's before your first campaign, and one of the first things you said to me was, I want to be a jobs governor, and that's one of the things you've done. And I want to ask you, how hard has it been for you to see up to 300,000 jobs, at least temporarily, go away? I mean, that has to be tough.
Well, I mean, when you talk about 300,000 jobs, you're talking about 300,000 people. 300,000 people that were likely doing better than they had ever done before. So this has been tough on our entire state. And then there's the fear around this virus and the word pandemic and all the things that have been very real that have affected our state, our entire country, and 190 other countries around the world. So you're right. Public health is still top of mind. It's defeating this COVID-19 and properly managing this. But the thoughts and ideas around putting more oxygen back in our economy and what that will look like, I have a lot of confidence that Arizona will be stronger and better in the future, but it's getting there responsibly.
So can we talk about some of that oxygen and where it may show up first?
Yeah.
We're getting a lot of questions about a bunch of different things. Elective surgeries. What will restaurants look like? Will we have half-full restaurants maybe, or half-full movie theaters and stadiums? Temperatures being taken. I know you're talking to members of the business community. What are some of the ideas being batted around?
So it just shows that this is common sense, and what you're talking about, Troy, is common sense. If we're okay on the PPE, which we wanted to get that so we could take care of any COVID-19 patient who needed care and comfort, we can restore elective surgeries in time. We'll probably begin in our rural areas and then bring it to Maricopa and Pima. Some of the things that we were able to shut down to slow the spread were our restaurants. Is there a way that we can reopen, allow some of that oxygen back in the economy while still safely socially distancing inside these restaurants? So that's the thought of, you know, being at a 50% capacity inside there, increased sanitation techniques, masks where needed and necessary, those types of things. Then the larger decisions that where we'll know that we're getting back to normal is when you hear something like a play ball signal signal, or are you ready for some football? That is going to be made more on a national basis. In Arizona, we're open-minded to some ideas that would allow us to be helpful in those situations. But in terms of what we can control here in Arizona, it would likely begin with elective surgeries and restaurants.
And we'll talk more about the Major League Baseball and football in a second here. I heard you yesterday on the Mac and Gato show, which I always like when you're on there. But you talked about testing and how important it is. And the U of A president came forward and talked about antibody testing. And you think that your wife and maybe your mother may have had exposed her to COVID. You said if you're tested, maybe get a little badge or a sticker like the I voted today sticker. Tell us about what you said there.
Well, I want people to know there's two different types of tests. One is diagnostic. So that's, if I take that test, that would tell me that I don't have COVID-19 today. But I could walk out of this interview and I could contract it after the interview. The other one is an antibody test, and that tells you if you had COVID-19 and recovered. And likely there's thousands, if not millions, of people that have been in that situation. I mentioned my mom was really sick in January. My wife and middle son were sick in February. Did they have COVID-19 and recover? The antibody test would tell us that. And then this would all be voluntary, of course, Troy, but if somebody wanted to wear something that said, I tested and I'm okay, or something like that, it would be, these folks would be in a different category, because according to Dr. Robbins and other epidemiologists, they likely would be immune for some time to contraction of COVID-19. So it puts them in a different category if they're a healthcare worker, if they're a service worker, if they want to re-enter the economy. And I think if we can talk about those types of things, ramping up our testing, have better data so we know who's sick, who's not sick, and who's recovered, will allow us to make better decisions and allow people to at least reduce the anxiety and real fear that's out there.
Right, and the fear, it seems like, is being generated by the unknown, and the more we know, the better it is. Let me ask you this, because I put it out on Facebook this morning, what do you want to ask the governor? And one of the main things was, would you be open at some point? Let's say May 1st, everything looks great, you start gradually opening up society again. Would you be open to allowing some sort of a graduation ceremony for our high school seniors out there who are looking at not having one?
Well, first I want to say my heart goes out to all these families, the graduation ceremonies, the wedding stories that I'm hearing that were planned for May and June and often now are looking for refunds or cancellations or scaling it down. I want to say I'm going to be open-minded to whatever I think is safe. I'm going to be working with the federal guidance, the Centers for Disease Control, and Dr. Kara Christ. Of course, I'd like to see some of these traditional and important landmark celebrations happen for our young people and our newlyweds. At the same time, I want to be straight that we want to not lose the ground that we've gained here. We've been able to avoid what we've seen happen in Detroit and New York and Seattle and Louisiana. So let's think of the guidance today is through April 30th. We'll know so much more a week or two from now, and we can talk at those times as we know more. I'm going to be sharing information in real time. People can go to azhealth.gov to see the statistics, or aztogether.org to either volunteer or contribute, or if you need help or need access to government benefits.
All right, Governor, I've got just about a minute left, but I've got two more questions, so I'm sorry to rush you here. What those conference calls with the president and all the other governors, I was on my first Zoom call yesterday, and it was kind of a mess with 5 people. Are you all in little tiny squares? How does that even work?
We don't use Zoom. We use some kind of federal transmission through what's called a VTC. It's worked very well. I can see the president, and the president can see me. I can't see all the other governors, but when a governor does speak or ask a question, they pop up on the screen. So the calls have been effective. And outside of the governor's conference, I've done some of these Zoom calls, first time I've ever done them with some people in the business community. My Zoom calls have worked well. They haven't been crashed or had anybody jump on the call, and I know they've upped their security.
They have. All right, last question. Major League Baseball, again, we're almost out of time. You said yesterday that, yeah, you're open to this. What kind of discussions have you had with Major League Baseball? I mean, do you think, bottom line, this could happen, that all 30 teams come here to play and start the season?
It's aspirational, and Arizona is open-minded to it. I've had discussions with the commissioner. I'd like to thank Derek Hall and Ken Kendrick of our hometown Arizona Diamondbacks. They're the ones who made the connection. Arizona's uniquely equipped to do this. There's ways we could do it with every player's tested. They're quarantined inside hotels. The idea right now is there wouldn't be any fans. Of course, it's aspirational. There's a lot more to do, and it's going to be more up to Major League Baseball, and I want to work with public health if it's safe, but I wanted people to know I am open-minded to this idea.
Governor Ducey, thank you so much for coming on, all your efforts in this, and you are welcome back on anytime as we continue to move forward in this COVID-19 situation. Thank you again for coming on.
Thank you, Troy.
All right, latest numbers now.